Hi there, and welcome to another edition of the Ask Dr. Jack Show. I am Dr. Jack Belitz, chiropractor here in Omaha, Nebraska, bringing you information that you can use to make better and helpful decisions for your own personal health and that of your families. Not here trying to give you medical advice whatsoever. That's especially true on today's episode as we talk about tests that are probably things that you should avoid. Okay, so how did this all come out? Well, there's always the people that are saying, okay, there's not enough health care around. And while you can make an argument for that, you can also make an almost equally, if not more important argument that there's too much health care being distributed right now. If you look at the studies, there are so many people that are suffering from the side effects of drugs and procedures that didn't need to be done in the first place, or that are overdone, that it's ridiculous. And so there is a group of researchers who noticed this and said, hey, let's start looking through this data that we have here and see if we can find some tests that might be better if we didn't do them. And I thought this was brilliant. And so what they did was they narrowed it down to 4 tests that were just being overdone. And when these tests were done, they were creating the necessity, quote unquote, for procedures that were really not correct. So basically what they said was the overuse of medical care consisting primarily of overdiagnosis and overtreatment is a common clinical problem. It is not only a waste of time and money, but also can result in needless harm and even death. So what a great motivation to get through these studies. So what are the 4 tests? I'm sure at this point you're on the edge of your seat waiting for me to answer that. So let's go to it. The first one is routine ultrasound screening of the carotid arteries. Now, if you look at the literature that's out there and go to offices and stuff like that, what you'll see is that it's a really smart thing to do, and it's supported by 9 out of 10 cardiovascular doctors, and they recommend that everyone over the age of 50 get a screening every year because it will reduce your chance of stroke. Well, I have one word to say to that, and that is baloney. I know you're thinking there was a different B word, but okay. The truth is that there's no documentation for this benefit at all. I mean, no studies have shown this. In fact, there was a United States government task force that demonstrated no studies provided data on whether screenings for carotid stenosis reduced stroke. But that's not all. The same task force said that the ultrasound of the carotid arteries had so many false positives that they were more likely to be false than not. So what happens when you get a false positive? Well, you're going to probably be talked into a procedure like going in and reaming out the arteries. And if you look at the potential for harm to this procedure, it's absolutely ridiculous. That's that angioplasty or stenting. And subsequent, so according to the doctors, these procedures, the surgery to clean out the arteries, does not reduce the mortality rate for people in general. So it's like, why do the procedure at all if it's not going to produce it? Well, because my ultrasound said that, so maybe we don't do the ultrasounds. All right. Next example is thyroid cancer. Now you're thinking, oh my gosh, it's cancer, right? Well, there was a study that was done a few years ago on cadavers, and they found that if you were over 60, you had a 100% chance of having thyroid cancer in you. Wow! But yet, how many times do you hear of somebody dying of thyroid cancer when they're over 60? I know I haven't heard anything about that. So anyway, one of the best ways to look at this is South Korea, because South Korea started doing this big, huge thing about ultrasonic thyroids and looking and trying to treat these thyroid cancers. And between 1993 and 2011, the diagnosis of cancer in South Korea increased over 15 times. And basically what happened was, when they were diagnosed, all these patients had part of their thyroid or all of their thyroid removed, which meant that now they're having to deal with the thyroid replacing hormones therapies that needed to be done. You could also have problems just in the surgery itself, like hyperthyroidism or vocal cord paralysis. Now, here's the thing. If there was a benefit, maybe it was worthwhile. But what they found was there was no change in thyroid cancer mortality. So an overdiagnosis of thyroid cancer is extremely common in our society today, and probably for very little reason. The next one applies to the females. It's the dreaded pelvic exam. And what they are finding was there is no evidence to show that routine pelvic exams on asymptomatic women, in other words, if you don't have any symptoms but you still go in for the pelvic exam, gave you any benefit at all. In fact, the American College of Physicians recommends against routine pelvic exams because there's more chance for doing harm than there is for good, both discomfort, anxiety, psychological harm, and embarrassment. So that hopefully is good news for you. If the American College of Physicians is recommending against it, that should give you a good feeling in your heart that you can forego that procedure if you don't have any symptoms. The last one that we're going to talk about is CT scan of the brain. Here's the problem, is that you're given so much radiation during this test, and there's so little that actually comes out of it. During that time, there's a study that was done over 130 patients over the course of 1 year. And these people had an average of 7 CT scans during this time. Over 90% of these CTs were designated as useless. Only 4% of the head CTs had clinical significant and impactful impacted patient management. 4%. So if that doesn't show you that there's an overuse of that procedure, I don't know what does. So here's the thing. For years and years and years in our past, people doctors would see people with no test at all. They'd take a good history, they'd do a physical examination, and they'd make a diagnosis. And quite frankly, the studies are showing that's what it takes now. So with all these tests, it's overkill. In fact, I had a patient that came in one time with a 2-inch binder full of tests. I mean, she went to Mayo, every place. I said, well, what did they do? Well, they did all these tests on me and they found a lot wrong. Okay, what did they do? Well, they didn't do anything. It's like, wow, what a flipping waste of money. Now, I don't care if it's coming out of her pocket or Medicare or whatever, it's still a waste of money. So these are things to keep in mind, that a good case history and a good physical examination will do a really great job of diagnosing most people if you have a decent doctor. In fact, to be honest, studies have shown that as far as medical doctors are concerned, 75 to 80% of the cases a doctor treats are going to get better no matter what they do, whether it's nothing, a placebo, or an actual medication. 75 to 80%. Now, obviously, you don't want to be in that 20 to 25% where it's a big deal. But let's face it, that's why you have a good doctor. That's why you get a second opinion when you need one. You don't just run out and get testing for no reason. I mean, we're all so worried about the test results, and there just isn't any clinical significance for this. This is hitting me hard in my life right now with people that I care about. They want all this testing done, and it's just not giving you any basis for treatment. So anyway, that's the end of this episode of the Ask Dr. Jack Show. I'm Dr. Jack Belitz, a chiropractor here in Omaha, Nebraska. Not giving you medical advice, but just giving you information that you could have very easily gone on the line and found this study or these studies. Just bringing them to your attention so that you can use them in your debate in your head as to whether or not you want to do certain things. I hope you have a very happy and healthy day. If you have any questions, please give me a call, 402-333-4848. We're here to help you, serve you in any way possible. We do a lot of amazing things with people, and I'd love to help you out too.